So I have a little bit of, a lot of imposter syndrome right now because I'm just a geographer and a college professor. And so I don't do the kind of work on the ground, professional practice, all of you are doing. I haven't been to Southern California in a very long time. My knowledge of this region that I'm going to talk about, I feel a little bit safer because my knowledge of the region I'm going to talk about today is based on analysis of secondary data and analysis of historical documents. And I only feel comfortable doing this because I've developed this project in a different urban center, but in Hampton, Virginia, southeastern Virginia. But the urban processes that are driven by historical inequities, the things we've already heard people talk about, how they manifest in Virginia is actually really similar to how they manifest here in San Diego and across the country. So I want to be clear about what I know and also what I don't know, so that later on, if there's any questions and I have to say, I don't know, I've already kind of bracketed that out, all right? Let me also first and importantly recognize my research team. They've all just graduated from college and they're moving on to much bigger and better things. The last time I was in Southern California, I was actually in Redlands giving a talk for a software company at Redlands, and Shakira, she came with me. We were out in Redlands. The last flight that I took before the pandemic in January of 2020, we were up there, and she gave a wonderful presentation of this talk, which she's preparing to go do her Ph.D. in sociology at Rice University, and couldn't make this trip to probably a better presentation than I would. But let's get right to it. I'm a geographer. And I'm a total map nerd. I love maps. I can spend lots of time with maps. I think maps are so important as visual and tools of visual communication. Maps tell stories. And one of the most, most impactful maps of the last 10 years that I've seen is this racial dot map of the US. One dot per person in the entire country, based on the 2010 census. So it's a little bit outdated at this point. 310 million dots on this map, all color-coded by race and geolocated on the city block where that person lives. And what we see is that in city after city, this is New York, for reference, here is Manhattan, Central Park is this square right there. In city after city, in neighborhood after neighborhood, in block after block, when folks go home to their apartments and their homes on the end of the workday, they go to homes that are on blocks in neighborhoods that are mostly populated by other people who look an awful lot like that. This is reproduced, of course, in New York. We think of it as an incredibly multicultural, diverse city, but also a very segregated city. We think about this in Chicago, statistically speaking, one of the most segregated cities in the country. And speaking of Detroit, the resolution isn't great here, but the city of Detroit, another one of the probably 3 or 4 most segregated cities in the country, with the infamous 8-mile road dividing the majority black city from the overwhelmingly white Macomb County to the north. And so my work, the questions that kind of animate my research as an urban geographer are pretty simple. Where did this come from? How are these landscapes of inequality produced? What are the impacts in the present day? Why are we still talking about this? Didn't we pass the Fair Housing Act, in 1968? Next week, it'll be 54 years since we passed the Fair Housing Act. Why are we still talking about this? And once we answer the why are we still talking about it question, because it's a big answer, well, what do we do about it? And I'm going to try to answer all these very quickly. And I'm gonna punt though. I'm gonna give you a little preview. I'm gonna punt on the last question because the last question is really a lot more up to you all than it is up to me. So let's get right to it. Where did this come from? It came from a lot of places. Spoiler alert: it wasn't by accident, right? This is not kind of a coincidence. This is not birds of a feather flocking together. Racial segregation in the U.S. was produced. It was actively produced through intentional and intentionally racist and discriminatory housing policies emanating from the federal government for much of the 20th century. One of those policies is redlining. In redlining, this is the 1936 Redlining Map of San Diego. And what redlining was in the middle of the Great Depression, it was essentially part of the New Deal economic packages to help homeowners refinance mortgages and get better access to mortgage insurance and things like that to help prevent homeowners from losing their homes. And the US government sent out thousands of what they called raters to rate neighborhoods on their creditworthiness, on their worthiness for receiving these kinds of favorable refinancing terms in the midst of the Great Depression. And neighborhoods were rated according to a 4-tier system. First, second, third, and the lowest or hazardous neighborhoods were red on the map, and hence redlining. And those neighborhoods were cut off from government support, housing support during the Great Depression. What's wonderful about this map is that it actually, every single neighborhood in this map of San Diego has a sheet with a description essentially explaining why the neighborhood, in this case in La Jolla, why this neighborhood was given the highest category. And it's hard to read. The resolution is not great, so let me read from here where I can actually see it. This is the original 1936 data for La Jolla. This area is known as Muirlands, topography sloping towards the hills with magnificent views of ocean and La Jolla. Lots in this neighborhood carry deep restrictions as to race, building, and architectural design. And for context, what they mean is that properties, the lots of properties, carry restrictions, and those restrictions look like this. I'll read quickly. This deed is expressly made subject to the following conditions and restrictions. Let's skip to number 2. The said property or any portion thereof shall not be devised, conveyed, or leased by deed or any other way to any person of African descent for a period of 15 years from the date hereof, and that any such devised, conveyance, or lease shall be void. And then third, and this is particularly relevant to our discussion today, that no liquor or ardent spirit shall be made or sold on the property for a period of 15 years from the date hereof. La Jolla, I should be clear, this deed is not from La Jolla. But the fact that in this 1936 government document, they're talking about lots carrying restrictions on race and buildings, architectural design, it's very, very likely that if you go over to the courthouse and dig through the property records, these deeds are still in millions of properties around the country, and I have a very strong feeling that we'll probably find something just like this in properties there, restricting it as to race and prohibiting what they already in the 1930s were understood to be something that they don't want in their neighborhood. Production and sale of liquor. This one goes on, and forgive the resolution. This one goes on to say that residents are 100% white, and that there has been no influx whatsoever of any inharmonious influences. Homes naturally show a high pride of home ownership and are excellently maintained. All city utilities are in, meaning roads are paved, street lights are there, sewers are engaged, and so on. I'm happy to share my slide deck so that you can spend a little bit more time with these. But if you go through and look at the highest rated neighborhood after the highest rated neighborhood, you see essentially 2 common themes. Theme 1 is that they're all white, and they're all white by law, by these deeds that are inserted into properties. And theme 2 is that these neighborhoods are well invested in. Not only do they have pride of home ownership on the one hand, but they have all kinds of city services on the other hand. I'll skip forward to this one, talking about how schools of all types, together with state college, transportation, markets, etc., are easily accessible to this area. This is an intentional kind of understanding of what makes a neighborhood good and worthy in the context of the 1930s, worthy of being saved. And as you'll see in just a second, when we shift over to talking about Redline's neighborhoods, the neighborhoods that were on the opposite end. This is a small Redline's neighborhood in La Jolla. It says this area is known as the servants' quarters of La Jolla, being populated with the serving class of whites, Negroes, and Mexicans. Forgive the language, this is an official US government document. Homes show little pride of home ownership. The particular area is set aside by common consent for the colored population. And if you look across in redline neighborhoods across San Diego, what you see is the opposite descriptions of what you saw in the previous. These are areas that were being infiltrated by people of color. There were areas that lacked private home ownership, and there are areas that they're just stating that have dirt streets, that don't have streetlights, that don't have all these services. What they're saying is these are neighborhoods that have not been invested in by the city, by the county, by the state. And so I won't dwell on this anymore. The document that contains all these descriptions is about a 25 or 30-page document that describes neighborhood after neighborhood after neighborhood from, in their words, best to least, or best to worst, I should say. And this process of redlining was a process that happened in nearly 250 cities across the country. This is a map. It's an interactive map. If you go to the Digital Scholarship Lab at the University of Richmond, you can explore all 250 redlining maps in the U.S. down to the detail of the neighborhood descriptions in any given city across the country. So, I should say, when I teach my urban geography course, I spend several weeks covering this urban history. So I'm trying to move fast for the sake of time. But if redlining was a policy during the Great Depression, another set of federal policies in the aftermath of World War II are worth also thinking about as well. Because during the Great Depression in the 1930s and during World War II, the first half of the 1940s, this is a period, broadly speaking, during wars and depression, fertility rates actually drop and the population doesn't grow very fast. And also during wars and depressions, the country doesn't build a whole lot of new housing. But immediately following World War II, we went into this 20-year baby boom, if you can call it the baby boom generation, with the fastest rate of population growth in the US in the 20th century happened in that 2-decade period, and it created a housing crisis. Not enough houses for this rapidly growing population. And so the US government essentially adopted two policies to try to solve that problem. Policy number one was to build public housing in formerly redlined neighborhoods. In city after city across the country, public housing is primarily built in neighborhoods that were formerly redlined or in neighborhoods that are immediately adjacent to formerly redlined neighborhoods. And they followed what was called a neighborhood composition rule, where those neighborhoods, that public housing would be segregated the same race as the population living in the neighborhood beforehand. So public housing was essentially targeted and built in majority non-white neighborhoods and segregated as such. And on the flip side of the coin, to solve the housing crisis for white people, they built the suburbs. And in order for William Levitt to get financing to build Levittown in Long Island, 19,000 homes on Long Island, and William Levitt alone, that one guy, built 7 different cities called Levittown. Levittown, New Jersey, Levittown, New York, Levittown, Pennsylvania. There's even Levittown in Puerto Rico. And to get finance, he didn't have capital to build that number of houses. He got loans from the FHA, the Federal Housing Administration, and the FHA required him, as a condition of receiving a loan, to insert in the deed of every single one of those properties a racially restrictive covenant. So the suburbs, it didn't happen to be that white flight, like a bunch of white people randomly decided to move out to the suburbs in the 1940s and 50s and 60s. They moved there because they could, and nobody else moved there because they were explicitly prohibited from doing so by the federal government. And so what we see then is, and I only just scratched the surface of these policies. We see policies of redlining, policies of public housing, policies of racial covenants blocking people of color from moving to the suburbs, but also we see policies of zoning boards and exclusionary zoning. We see discriminatory lending practices by banks, racial steering by realtors. What this means is this is a 100-year project of disinvestment in Black and brown communities across the country. A 100-year project of intentional and frequently legally binding disinvestment in non-white communities across this country. So what does this mean then for the present? Because after all, we did pass the Fair Housing Act in 1968. The Supreme Court, a few years before that, found racially restricted covenants to be unenforceable. Why are we still talking about this? I think I have this yet. President Johnson, April 11th, we're coming up on the 54th anniversary of the Fair Housing Act. Why are we still talking about this? And I think if there's one single graphic that answers the question of why we're still talking about this, it's this. And I know in the context of Southern California, in the context of where I'm from, where the overwhelming majority of the population is, according to the census, self-reports as either being black or white. I think in my urban area, almost 2 million people, over 90% either report being black or being white. It's a kind of a binary. I know in Southern California it's more complex. In a lot of the country, it's more racially and ethnically complex. So forgive me if this is a bit simplistic, but between the median black family and the median white family in the US, there is about a 40% income gap. That is, the median black family income, annual income, is about 40% lower than the median white family income. But in terms of wealth, in terms of your actual net worth, there is a 90% gap between the median income of white families at $170,000 and the median income of black families of $17,000. This is because, and when we're talking about the median, that just statistically means 50% of families are richer or have more wealth, 50% of families have less wealth. It's not the average, it's the median. And what this means is that for the median, the family in the middle, that white family, this $170,000 is the result of having essentially white neighborhoods invested in through housing policy and other economic policies for 100 years, building up wealth through housing that accumulates over one's life, it's passed on and accumulates generationally, while people of color were, through law and practice, prohibited from accumulating that same wealth. So even though we passed the Fair Housing Act in 1968, this is data from 2016. This is the long-term impact in the present day of the policies of the past. Now, what does that look like geographically? I made a bunch of maps of San Diego, and this is what I'm saying. I've experienced San Diego through secondary data much more than I have since my arrival here at 5:20 this morning. What you're seeing here is I superimposed onto a side-by-side map of San Diego County of the redlining map. So you're seeing on the map on the right-hand side, these are the neighborhoods that were redlined in the 1930s. The map on the left-hand side, these are the neighborhoods that got the 2 highest rankings on that 1936 redlining map. And when you map that out by race and ethnicity, this is a map that shows the predominant racial and ethnic group per neighborhood. Neighborhoods that in 1930s got the highest rankings are predominantly white, and neighborhoods that were redlined today are predominantly not, predominantly Hispanic, Latino, using the census categories names. If you look at this in terms of poverty, this is in terms of poverty. Neighborhoods that escaped redlining, 85 years ago, are today have half the poverty rates. Neighborhoods that were redlined today have twice the poverty rates. And as that builder of wealth, what you're seeing here is that home values in neighborhoods that were redlined are less than half on average of neighborhoods that escaped redlining. And if we were to take into consideration the fact that the redlined neighborhood in La Jolla is no longer a neighborhood that's populated largely by people of color working as servants for the other folks surrounding them, and that the median home value up here in this formerly redlined neighborhood in La Jolla is $1.7 million. If we took that out, the median home value in redlined neighborhoods would drop even more. And in Southern California, it's not as much a problem where I live, but in terms of housing affordability. This is a funny map to read, but the area of concern, this map compares home values to household incomes, because if the home values are really high, the cost of living is high, but if you're making $1 million a year or more, then it's not so bad. You can pay the rent, you can pay your mortgage. The areas of concern are where home values are high, but household incomes are low. That's that bright blue on the map, where home values are high, household incomes are low. And what you can see on this map is that formerly redlined neighborhoods now have the most acute kind of impacts from the housing crisis, of the crisis of affordable housing, let's say, in Southern California. I have so many more maps, and I'm going to get to them in a second, but I just want to point out that if we're thinking about the add-on impacts, the cumulative impacts of this, the fact that we fund our schools based on property taxes, and then we populate our schools based on neighborhood, it really should come as no surprise that nationally speaking, there's a $23 billion per year gap in funding between predominantly white schools and predominantly non-white schools. And there's increasing research about the environmental consequences as well. And I think we're probably all reminded of the reality of climate change on a day like today when we're double digits temperatures higher than the normal for April, what is it today, April 8th or April 9th. It's not supposed to be this hot. And when we're looking at tree canopy, on the right-hand map, tree canopy in redline neighborhoods compared to tree canopy in neighborhoods that escape redlining. And the opposite, what drives urban, what's called the urban heat island effect, what drives this map is a little hard to read, forgive me, is the combination of tree canopy cooling neighborhoods and impervious surfaces or pavement heating neighborhoods up. Redline neighborhoods have significantly less tree canopy, significantly more pavement, and as a result, a recent study shows this is the daytime temperature on one random afternoon in June of 2021. In redline neighborhoods, daytime temperatures in the summertime daytime temperatures are almost 6 degrees Fahrenheit hotter in neighborhoods that were redlined 85 years ago compared to neighborhoods, in some cases, just a couple of blocks away. And if we know the poverty rates in formerly redlined neighborhoods are already twice the rate, and we know that they're much more likely to be renters compared to homeowners, what we know is that this population is less likely to have double pane windows, less likely to have adequate insulation, more likely to have kind of substandard air conditioning units if they have air conditioning at all. And this can turn into really quite profound health crises in the context of climate change and rising heat waves. So in this I pulled the data for a bunch of cities in California. This is the temperature differential between formerly redlined neighborhoods and neighborhoods that escaped redlining for several California cities for the sake of comparison. Well, that's kind of a zoom out, and again, I wish the contrast was a little bit better here so we can see. If we zoom out to the whole of the county, the whole of San Diego County, this is what it looks like in terms of race and ethnicity, the predominant racial and ethnic groups. And so in red is, again, using census language, is Hispanic Latino population, and blue is white population. And then if we look at that's a fairly simple, here's for that center of redlined neighborhoods. And then here, for our reference, this is that map of poverty. So the map of poverty follows a kind of similar spatial organization than the map of race and ethnicity because of all the historical factors that we've just discussed. And I want to kind of shift gears and broaden out to think about something that's called the Social Vulnerability Index. The Social Vulnerability Index is a measure of 15 different census variables that focus on socioeconomic status, on household composition and disability, minority status and language, and on housing type and transportation. And they look at specifically things like poverty rates, unemployment, income, education, on age and disability. They look at things on racial and ethnic minority status and language, and they look at things in the actual physical infrastructure in housing. And what strikes me is that an awful lot of these variables that they're looking at when they're trying to calculate the relative level of vulnerability of a neighborhood, a lot of these things are the same things that if you connect it back to that 1936 redlining map, it's the same things that they were talking about in terms of investing in all white neighborhoods and the resulting disinvestment in primarily non-white neighborhoods. A lot of these variables get at that idea of investment versus disinvestment. And so when you map out San Diego County in terms of social vulnerability, what we see in red, the red census tracts here are the 20% most socially vulnerable neighborhoods, and the orange are the second 20%. So really the most vulnerable areas are the dark orange, this color, and the red. These are the most vulnerable areas in the county. And what I want to look at now is how onto those neighborhoods we've layered all kinds of subsequent harms and hazards. For example, and again, for reference, I'll put the Redline Neighborhoods in there. If you map out toxic release sites, these are sites that the EPA tracks of frequently carcinogenic toxic releases into the air, ground, and water. Those sites, within a 1 mile buffer of those sites, the population is disproportionately non-white and high poverty. And right here, we have almost, I think it's about 20 or 21 toxic release sites in the kind of the center of these redlined areas. And you add on to that the interstate highway system that's been built through the 1950s through all the way up into including the present day. There's a lot recently being talked about in terms of the intentionality of building urban interstates through non-white communities, including some great work on historical research that's been going on in LA, and also talk in terms of the infrastructure bill about how do we undo some of that. But if we layer onto that, it was mentioned, I don't have a map for it, the food desert status. That would be a map that largely looks the same as the map that we already see here. Another one that is kind of famous case study in my world is of payday lenders. These are lenders, cash in places, payday lenders that have thousands of percent APR and interest rates on emergency loans. Of 231 total payday lenders in the county, 60% of them are in, more than 60% are in neighborhoods that are the most socially vulnerable, and less than 10% are in neighborhoods that are the least socially vulnerable. What is commonly referred to as predatory lending is concentrated in the most socially vulnerable neighborhoods in the country. Of the 2,052 off-sale liquor licenses in the county, again, we can see a really similar kind of spatial pattern happening, where about half of them are in the 40% most socially vulnerable neighborhoods, and less than 15% of them are in the 20% least socially vulnerable neighborhoods. And so what we're seeing is a concentration of, and this is just of the least vulnerable to the most vulnerable, is we see an increasing concentration of off-sale liquor licenses in the most, and progressively more and more vulnerable neighborhoods, more and more vulnerable census tracts. I do have data also for cannabis licenses, but there's not enough of them. The sample size isn't large enough to discern out a real clear geographical pattern in the same way. But I suspect that once there are more, as that industry grows, I suspect it will follow another similar spatial pattern going on here. And then when you get right down to it, and I think the chairman of the Board of Supervisors, Chairman Fletcher, made this point earlier, when you get right down to it, this translates into unequal health outcomes on individual bodies. And so let me just show you, this is I promise my last series of maps. It's just a couple, this is data from the CDC at the census tract level, so basically at the neighborhood level of, for example, the lack of health insurance. The neighborhoods that have been most disinvested are most likely to have populations where more than 20% of the residents of the neighborhood lack health insurance. They're also the same neighborhoods with heightened rates of asthma. As you can see, this concentration of folks suffering from asthma right in the middle of those formerly redlined neighborhoods that are immediately adjacent to 20 or more toxic release inventory sites that are surrounded on all sides by interstate highways. You see diabetes rates heightened in that same spatial pattern. If you're seeing that these are all the same map, it's the same. The map of redlining is the same as the map of interstate highways. It's the same as the map of asthma. It's the same as the map of diabetes or of obesity or of even the data from the CDC on increased mental health distress calls. And when you get right down to it, the point was made earlier, is the difference in life expectancy. And he wasn't lying when he said there's a 10-year difference. But you don't even have to go all the way to the southeast portion of the county to find that 10-year difference. In La Jolla and here in Coronado, the life expectancy at birth, the data point is life expectancy at birth person who is born today in this census tract can be expected on average to live to 84, and you don't even have to go very far to have just across the water to neighborhoods and forgive me, I don't know the colloquial names of the neighborhoods as well, to these neighborhoods where life expectancy drops 8, 9, even 10 years as you move just a few blocks in another direction. Kind of the long-term cumulative impact calculated in years off of life. So I'll stop there and just make one final remark about kind of where do we go from here? And I think, like I said at the top, where we go from here, it has a lot more to do with professionals, dedicated professionals working on the ground than it does with people like me kind of looking at secondary data and waxing philosophical about it, right? But I think where we go from here, and I think it was so perfect to hear this discussion of the upstream causes. In my language, we use kind of the term structure, the underlying structures, to get at the exact same idea, right? We can continue to treat symptoms, and I certainly understand the impulse to deal with symptoms, because that's what we see every day. Last week I was talking with a group of property assessors in New Orleans. The week before I was talking with a group of law enforcement officers. The week before that with a group of students, and everybody wants to know, kind of, what do we do? And if you're talking to law enforcement professionals, and at least in my city, we're having a massive increase of gun violence. And it feels crazy to talk about underlying structures or upstream when you have shootings every single day. It seems crazy to talk about underlying structures when we have really serious problems right now of homelessness, of substance use disorder. So I understand the urgency of treating the symptom, but it's so profoundly important that we also think about think about rupturing the structural production of the underlying cause. And we got to be able to do both at the same time, right? But we got to be able to fund the fund and put resources into. And this is, sorry, I realize this is not at all a criticism of what's going on here. Me saying because I just don't know. If I were talking to my home state audience, it would be a criticism. Because in that context, it's so hard to divert, it's not even to divert, to add attention and to add funding to look at upstream causes, or what I call the structural causes, when the visible impacts on the street are so real. And I think we really need to be able to think about how we do both of those things at the same time. So with that, let me conclude, say thank you very much for listening, and I'm happy to take questions or hear your thoughts.